Welcome to Arirang Live. It's 11 a.m. here in Seoul, and I'm Kim Dami. In just a minute, we're going to cross over to the latest briefing from the South Korean health authorities on the COVID-19 outbreak. This is the first briefing of the day, and just before we came on the air, we learned that South Korea has reported 6 new COVID-19 cases on Saturday, and all of them are imported cases. That brings the total number of confirmed cases to 10,780. For the past 4 days, the daily number of confirmed cases has remained under 10. With 2 additional deaths, the death toll stands at 250. The briefing has begun, so let's take a listen.
We also have sign language translation available. First of all, here is Mr. Son Young-lee on the briefing on the coronavirus outbreak. Let us now begin our regular briefing for May 2nd, Saturday. As of today, midnight, we have 6 new patients, and we have a total of 1,407 people in quarantine undergoing treatment. The death toll stands at 250, and this increased by 2 from the day before. I send my deepest condolences to the deceased and the members of the bereaved families. All of the 6 new cases were imported cases, and there were 0 domestic cases. And looking at the 6 imported cases, 3 of them were reported at the airport quarantine and 3 have been reported on a community level. This morning, the KCC held a meeting presided over by Prime Minister Chung Se-kyun, and we touched upon issues of the entrance from overseas as well as the samples testings for the public. And Prime Minister Chung Se-kyun said this morning that fortunately we had no near zero cases of imported cases that were beyond the control of the quarantine authorities. And however, we have a large ratio of imported cases, and this calls for us to not let our guards down going forward, and we need to be supervising this the trends of the global society going forward. And from this week, we have increased the public mask rationing system from 2 to 3, and he also mentioned that wearing face masks is very important when you go to public spaces. And as for the future of the screening clinics is as follows. These screening facilities were set up so that we could be curbing the further outbreak of the COVID-19 throughout the community. And we have provided our budgetary support, and we have extended the number of screening clinics. Ever from the beginning of the outbreak, thanks to the close cooperation with the municipalities and the hospitals, we have a total of 638 screening facilities nationwide. And up until now, out of the 600,000 cases of testings that we have carried out, we had about more than 500,000 of them. And also they carried out about 6,000 cases of testings on a daily basis. And they have contributed greatly to the curbing of the outbreak here in Korea. And we have developed very innovative ways of screening, especially the walk-through and the drive-through facilities are also being benchmarked by other countries, including the US and Japan. The government going forward, as we consider the change of the seasons and a decrease in the number of confirmed cases, we will be monitoring and coming up measures to how to deal with the decreasing number of the screening facilities going forward. And next is the trends of the foreign entrants. And starting from the 24th to the 30th of April, we had a daily of 3,200 people coming into Korea. And about over 78% of them were South Korean nationals. And starting compared to the previous week, we had a decrease in the number of foreign entrants. And out of the 700 people who are foreigners to Korea, the short-term foreigners who are coming into Korea decreased remarkably, and they are also people who have who have a long-term stay here in Korea. And we also had about 90.5% of the imported cases as South Korean nationals. And as for now, we believe that we will have a stabilizing number of short-term foreigners to come into Korea. However, as we have more exchanges with businessmen and as an increasing demand of South Korean nationals who are living abroad, we believe that we will have an increase in the number of people coming in from overseas. And at the airport quarantine, we have an average of 5 confirmed cases on a daily basis. Therefore, we believe that there is a need for us to strengthen our quarantine measures. And also, we carried out a sample testings for the metropolitan area, especially around nursing hospitals. And our aim was to identify the patients at an early pace. And out of the over 400 hospitals here in nursing hospitals here in the metropolitan area, we carried out a sample diagnostic test. And this diagnosis test was carried out at the Seoul City 구로구, 은평구, and Seongnam City in Gyeonggi, Ujeongbu, and Gumpo. So it's a total of 5. And we carried out about the testings for about 46 nursing hospitals, and there are which accounts for about 10% of the entire nursing hospitals at the metropolitan area. We carried out these diagnosis tests for 6,500 people who are patients and caregivers as well as medical staff, and everyone tested negative. So there were 0 confirmed cases, and this was carried out together with the KCDC, together with the public academies and the research centers. And this is called the pooling investigation into the sample systems. And we will be also intensifying our testings for such facilities, including mental care hospitals as well as nursing care centers. And considering the fact that many people who are administered at these nursing hospitals have chronic illnesses, we need to be staying on alert to protect these people. And we have carried out twice monitoring systems for these nursing hospitals, and we also carried out diagnostic testings for people with pneumonia symptoms. And there were 0 case of confirmed COVID-19 cases from such sampling diagnostic tests. We will be strengthening our monitoring going forward as for these facilities. Despite the difficulties, we would like to thank all of those who are exerting their full efforts to carry out these testings, and also in order to protect the safety and health of the senior citizens who are in the high-risk category. We understand that it is utmost important to have a safe environment as for the caregivers and medical staff members. And lately, we have seen a lot of discrimination against the COVID-19 confirmed cases, and these are spreading online. The virus does not discriminate people in terms of border or race, and therefore it is not just and not right for us to discriminate the confirmed cases. And as for discrimination and isolation from targeting a certain geographical locations will actually do more harm on the society as a whole. So we urge the public to halt any kinds of discrimination against the COVID-19 patients, and please cheer them going forward. And in order to fight over the COVID-19, we believe that instead of discrimination, it is important that we have a social unity. Thank you very much.
지금부터 질의응답 시간을 갖도록 하겠습니다. 브리핑은 사회적 거리두기
There you have it. And now to wrap up the briefing, South Korea has reported 6 new COVID-19 cases on Saturday, and all of them are imported cases. That brings the total number of confirmed cases to 10,780. With 2 additional deaths, the death toll stands at 250, and over 9,100 people have fully recovered and been sent home. We have another briefing coming up later in the afternoon. We'll again be providing live coverage of that session. Bye for now.